Plastic surgery has come a long way. Initially focused on reconstructive procedures, it addressed injuries and deformities. War veterans with severe burns, accident victims with facial trauma, these were the patients we aimed to help. The goal was to restore function and, when possible, a sense of normalcy. Over time, plastic surgery's scope expanded. Techniques became more refined, and the desire for aesthetic improvement grew. What was once solely about healing became also about enhancing. People sought to erase wrinkles, reshape noses, and augment features. This shift, while seemingly natural, brought a new set of complexities. The line between reconstruction and enhancement can blur. A nose job to improve breathing might also involve reshaping for aesthetic purposes. This duality is where the ethical and psychological considerations become crucial. As surgeons, we have a responsibility to understand the motivations behind our patients' desires. We must distinguish between addressing genuine distress and catering to unrealistic expectations. It's about helping people feel confident and comfortable in their own skin, not chasing an elusive ideal of perfection. The goal should be to enhance, not to erase, individuality. The transition from a single procedure to multiple surgeries can be subtle. It often starts with a desire to address a specific insecurity. Maybe it's a prominent nose, wrinkles around the eyes, or a less defined jawline. A successful procedure can boost confidence, but it can also trigger a different kind of focus. Suddenly, other perceived imperfections come into sharp relief. The initial satisfaction of fixing one thing can lead to a desire to address another, and then another. This is the slippery slope of body dysmorphic disorder, or BDD, a mental health condition where individuals fixate on perceived flaws in their appearance. BDD is a serious concern in the world of plastic surgery. It's not about vanity, it's about a distorted self-image. People with BDD often undergo multiple procedures, never feeling truly satisfied with the results. They may even become preoccupied with minor imperfections that others wouldn't notice. As surgeons, we have a duty to screen for BDD and other psychological factors. We must be able to identify patients who might be at risk for developing unhealthy patterns of surgery. It's about recognizing when someone is seeking a solution in the operating room for a problem that runs much deeper. The desire for plastic surgery often stems from deep-seated psychological factors. Low self-esteem, a history of bullying or trauma, and a need for external validation can all contribute to an unhealthy relationship with one's appearance. These underlying issues are rarely addressed by surgery alone. Body dysmorphic disorder, as mentioned before, plays a significant role. Individuals with BDD experience their perceived flaws with intense distress. They may engage in compulsive behaviors like excessive mirror checking or skin picking. Plastic surgery, in their minds, becomes a way to fix the problem and alleviate their suffering. Social anxiety and the pressure to conform to societal beauty standards also contribute to the issue. We live in a world obsessed with youth and beauty. Images of airbrushed models and celebrities flood our screens, creating unrealistic expectations. This can lead individuals to feel inadequate and seek out procedures to achieve an unattainable ideal. It's important to remember that true beauty comes from within. Building self-esteem, addressing past traumas, and cultivating a positive self-image are crucial steps in breaking free from the cycle of addiction. Plastic surgery should be a well-considered choice, not a desperate attempt to fill an emotional void. Section 4. Filtered reality, social media and the pursuit of perfection. Social media has undoubtedly amplified the pressures surrounding beauty and body image. Instagram, TikTok, and other platforms are saturated with images of seemingly perfect faces and bodies. Filters and editing apps further distort reality, creating an unattainable standard of beauty. The constant exposure to these idealized images can have a detrimental effect on self-esteem, particularly among young people. Studies have shown a correlation between increased social media use and body image concerns. The more time individuals spend scrolling through curated feeds, the more likely they are to feel dissatisfied with their own appearance. The rise of Instagram face, characterized by smooth foreheads, plump lips, and high cheekbones, has further fueled the desire for cosmetic procedures. Influencers and celebrities often promote these procedures, normalizing them for their followers. This can create a sense of pressure to conform, especially among those already struggling with body image issues. It's crucial to remember that social media presents a highly curated and often unrealistic view of reality. Comparing oneself to these filtered images is a recipe for dissatisfaction. Encouraging media literacy, promoting body positivity, and fostering a healthy skepticism towards online representations of beauty are essential steps in mitigating the negative impacts of social media. Section 5. Hollywood's Legacy, Celebrity Culture, and the Normalization of Surgery. Celebrities and public figures have long played a role in shaping beauty standards. From the golden age of Hollywood to the era of social media influencers, those in the spotlight often set the trends that others aspire to emulate. Plastic surgery, once a taboo topic, has become increasingly normalized within celebrity culture. Red carpet events and magazine covers showcase a seemingly endless parade of surgically enhanced faces and bodies. While some celebrities are open about their procedures, others maintain an illusion of natural perfection, further perpetuating unrealistic beauty standards. This normalization of plastic surgery can have a trickle-down effect on society as a whole. When procedures are presented as commonplace and desirable, it can create a sense of pressure to conform. This is particularly true for younger generations, who are often bombarded with images of their favorite celebrities and influencers. It's important to remember that celebrities often have access to the best surgeons, estheticians, and makeup artists in the world. Their seemingly effortless beauty is often the result of a team of professionals and a significant financial investment. Comparing oneself to these carefully constructed images can lead to unrealistic expectations and body image concerns.